Good afternoon. This is June the 4th, and this is the special meeting of the Board of Supervisors. Could I have the clerk do a roll call? I started to call you the clerk of something.
Supervisor Watson? Supervisor Angus? Supervisor Johnson?
Present.
Supervisor Gould? Okay, so as of right now, we don't have a quorum. I don't know if we want to wait a minute or two to see if somebody joins in, but as of right now, I only have Chairman Bishop and Supervisor Johnson responding.
Madam Chair,
Yes, go ahead.
you didn't ask who I was. Madam Chair, if we only have two members, we don't plan on voting on anything, so I think we can continue with the meeting.
We don't have a quorum.
So we don't have a quorum, and you're correct. We can go ahead and take the update from Denise, but we can't vote on anything.
Is that right?
Yeah, because there's no quorum, we're not discussing, I mean, you can discuss it not because there's no quorum, but we can't vote on anything, that's right.
Unless we hear somebody chime in. Okay. I'll see what I can do for that.
Madam Chair, members of the board, thank you for your time today. I've set up an agenda here for the meeting just so I can go through all the relevant items that I think will be of interest to you. As you know, you receive the hospital capacity update, hospital status update each morning, and I just wanted to make sure you didn't have any questions on that. Before I open that up, two questions. I'd like to make sure that I address Supervisor Johnson's question on Monday and make sure that just reaffirm his question and my response about
Hildy Angus.
There we go.
Havasu Regional Medical Center's capacity to scale up in the event of a surge. And in talking with the CEO of HRMC, he did mention that the current surge that they have experienced in the last 3 weeks, they have been able to easily handle. It really depends on the size of the surge, very much so. So in the event they had 50 cases come in, that would require several days to scale up their capacity, and they would likely call out to the other hospitals that are within their network. So they have a total of 86 hospitals within their corporation in 30 states. So they would likely reach out to those that are not experiencing outbreaks and request assistance. And it would just take the time to travel.
Has joined the conference.
So are there any other questions on the hospital status update?
Okay, do we have any other questions for Denise now that Supervisor Angus and Supervisor Gould have joined the meeting?
Supervisor Angus disconnected.
Oh,
But
okay, so
Supervisor Gould
Madam
is
Chair.
there.
we do have a quorum regardless. Supervisor Johnson, was that you?
Yes, ma'am, thank you. My question for Ms. Burley is, I understand they're saying, well, if they have 50, they have to ship them out, but my question really for them was, what is that number? And I was under the impression that they could add additional spacing for COVID only. That's what I was asking for. Let's say we got
Hildy
5 or 6
has joined the
COVID.
conference.
Hildy's back.
Let's say we got 5 or 6 COVIDs in, and that overloads them. Could they open up the COVID wing in an hour, 2 days? Would they have to ship those people out? That's kind of what I was looking for. That's one of the questions I keep getting.
Thank you, Supervisor Johnson, for that clarification. As I understand it from Michael Patterson, that is already ready to go. In other words, I would have to ask him how many days it would take, but I'm assuming that it wouldn't take very long because they already have those plans in place. But I understand your question, and we'll follow up with that.
Okay, are there any other questions?
Okay.
No other questions, Denise?
No, I'm sorry, Madam Chair.
Supervisor Angus, go ahead.
I had some technical difficulties getting in, and sorry if I didn't hear the answer to this. Did we get the results from the testing we did in the nursing home facility in Bullhead?
Apparently, those are coming in now. I don't have the exact numbers. We're reaching out to that particular facility to get some more information from them.
We're supposed to come back Monday. Or
Correct.
actually, yeah, Monday, right?
Correct. That's correct.
Okay. Thank you.
You're welcome. So next, what I'd like to do is discuss a little bit with you about what we've done for the community in terms of the personal protective equipment that we have distributed out to the community. This is really an important piece because we have a warehouse, we receive items from ADHS, and we spend a fair amount of staff time bringing that information into our inventory system and then responding to resource request forms and then trying to get those resources back out to those agencies so they have adequate levels of PPE. So I have a graph here. Tell me if I get it right, please. Do I have that? Thank you. Where you can see information about the PPE that we've distributed. So, for example, for the procedural masks, we've distributed 77,753 of those masks out to the community members. N95 masks have been 33,564. We have distributed, of course, a number of face shields and gowns and hand sanitizer and wipes, alcohol wipes, and a number of other items out to those agencies that were struggling to secure those resources to ensure that they had the appropriate PPE to provide the services that they do. So this has been a major undertaking. It's a continual undertaking in that we just received, for example, a shipment of supply today. We'll be bringing that into the warehouse and adding it into our system and then making sure that that is distributed again out to the community. So, any questions about PPE?
Any questions for Denise?
Okay. All right. Looking at other counties, our surrounding county surveillance for San Bernardino County and the city of Needles, I know it records right now 2 cases, and that may actually be an accurate count. We did learn the other day from someone who works for the county over there that one of those cases may be transferred over to a different county. Because that person didn't live within that county. So we will learn if that number changes. But right now they have listed 2 cases, and still in Laughlin we have less than 5 cases. So we continue to monitor those surrounding communities for any kind of outbreaks or increases in numbers and spikes. As you know, we were able to do the alignment with the daily report and the website, which was a major accomplishment for us, and we want to thank the communications director for helping us get that messaging out to the public to ensure they understood why those changes were made and adjustments and those corrections, because it's important for us to have accurate information out there. And we will continue to operate off of that and make sure that we provide those corrections so that the information that the public sees on our website is accurate. And that requires sometimes some adjustments. For example, yesterday we know at least one of those 2 cases that was removed from our count was a Laughlin case and or a Clark County case. So that got removed from our count and our caseload because it belongs to another county. Any questions on the case count and the report?
Are there any questions?
All right.
I hear none.
All right. We would like to use and update our webpage, and we're working with IT in the background to see if we might be able to add some of the tables that we put into the daily report to you all as a better visual tool for the public to see information and stats. So for example, what we're looking at providing is our cases by age. And if you look there, that's a chart that we can put in. We're also looking at, which you can actually see if I can put right back up, sorry. You can see a more equal distribution than we've had in the past in age ranges. And we can update also the age ranges to these more granular levels that we've provided to you. We can update that as well on the website. We're also looking at a table for cases by gender. Again, just an easier way for people to visualize caseload and cases and what genders are affected more or equally. We're also looking at a couple of other opportunities here. One would be the all case count by week of report, which basically shows our curve. So it shows the number of cases that we have each week going up, going down, et cetera. So we want to make sure that people can actually see a visual table rather than just seeing numbers going up. This will be a little easier to read. And finally, right next to this all case count by week of report, it'll be the percent change per week. So we would be offering that as well so that people, again, can visualize and see those numbers kind of and the percent change each week, and they don't have to do those calculations. So I believe we're looking at updating many of these on a weekly basis, and since we report and update the recovery information on Mondays, we would look to use Mondays as our tool in our day to update this information as well on a weekly basis.
Okay, I think that would be very welcome.
Thank you.
Yeah, I like that.
Okay. Any questions about that? Okay.
Does anyone have any questions of Denise thus far?
Okay.
None.
All right. I want to thank you all again for approving the additional up to 3 people to assist with our efforts. We have been able to actually hire somebody already for at least one of those positions, and that person will start on Monday, and it will be a tremendous help to us. We're also going to be requesting that the National Guards person that has been helping us in this effort as well be allowed to stay beyond the June 24th deadline. Right now, that person is under the National Guard and the federal orders allowed to work with us until the 24th, but we're looking at requesting that person to extend her stay with us. So if we can, we've actually involved her in some activities to assist with the testing of using the Abbott ID machine, which is very helpful to have another person trained and full, because when you're testing in that environment, you're in full PPE, so you want to keep that flow and have that person available for the tests and to just continue doing testing throughout the day. So we're working on that. In the event we are unable to keep her, we would look at a second person as well, and someone we could train to run those tests and, again, do the data entry for the MedSys and fulfill that role as well. Let's see here. I think what we'd like to request, and we could use the board's assistance in this, and we can certainly work with the communications director as well, is some assistance with continuing to get that message out of all the preventative measures that the public can take to reduce the spread. And this is an important topic only because I believe there's been kind of a change in mindset. If you've looked around, you may have seen scenes where you see a lot of people, groups meeting and families getting together. I think that's another thing, is you're starting to see more family gatherings. It's hot out and they're getting together and enjoying their company, and we want to make sure that that messaging gets out. So if you have newsletters or Facebook pages or things of that nature, if this is information that you can post and present and promote out in the community, we'd appreciate those additional avenues. Roger does a great job with getting that messaging out on our press releases, but it's always nice to see it in a new and different form and in different places. And then finally, what I'd like to ask is, are there any particular standing agenda items that you would like discussed at these meetings? Things that I can prepare for, things that I can make sure that you have appropriate information for. I know that a couple of weeks ago, Supervisor Angus had asked for information on contact tracing, and I haven't forgot about that, Supervisor Angus, so I would like to schedule one of my staff to provide an overview of that process. And I can certainly do that, I think, for next week. But are there any other items that you would like as a standard agenda item added to this so that I can prepare and have that information available for you at the meeting?
Okay, Denise, I think I'll go to each supervisor and get a list of the items that they would like to see added to a regular agenda.
Okay.
So we'll start with Supervisor Angus. Do you have any standard agenda items you'd like Denise to cover at each of these meetings?
No, I think she's doing a fine job.
Okay, Supervisor Gold?
I just want to have the, what are we calling it, the recovered numbers given out once a week.
I'm sorry, Supervisor Gould, could you repeat that, please?
I would just like to make sure that we get the recovered numbers once a week.
Yes, thank you. And I realize on Monday, I believe the report initially, I don't know if it was sent to you by that point, but we did reach out to the person who generated that and make sure that we updated those numbers. So we'll follow up with that. Thank you.
Thank you, ma'am.
Supervisor Johnson?
The only thing I could see that we might need to add that comes out in the reports, but it might be good for the meeting, would be to say, what our total is also for the, up to date.
Okay. All right. Thank you. And that was all I had on my agenda at this point.
Okay. Does anyone have anything else before going on? If not, I would like to open up a discussion on rotating meetings. We have a couple meetings coming up.
Madam Chair, I'm sorry.
We have a couple meetings coming up, one on July 20th in Bullhead City and in Lake Havasu City on October 19th. And because we're still under the COVID-19 concerns, I'd like to open a discussion about reassessing this and possibly waiting until the end of the year before we decide what we want to do with our meetings. So does anybody have any comments or?
Chairman Bishop, I don't know if that's something we would address during this meeting.
It's COVID related, so that's the reason to put off the rotating meetings.
Oh, to put off the rotating meetings was because of the COVID?
Yes.
Okay, we can stay within that, within those parameters. Thank you.
Okay. Okay, any input from anyone?
Madam Chairman.
Supervisor Gold, was that you?
Yeah, it was.
Go ahead.
I'm okay postponing the rotating meetings as long as we end up rotating as many meetings as we had planned on originally.
So you're stating
If that makes sense.
you're okay as long as we continue when safe to do so? Is that what you said?
Correct, ma'am.
Okay, anyone else? Supervisor Gold, can you put that in the form of a motion?
I will try. I move that we postpone the rotating of the meetings until the first of 2021, and then we return to rotating the meetings quarterly as we had been doing before the COVID crisis.
Second.
Okay, we have a motion and a second. All those in favor, say aye.
Aye.
Any opposed? Okay,
Madam
motion
Chair, I have a
passes.
question.
Supervisor Johnson?
Thank you, Madam Chair. It's for Ms. Burley. We talked about the under investigation at Monday's meeting. I haven't seen any kind of an update. Are we to continue to see these under investigations every day?
I think until I can bring this new data entry person on board and we have the opportunity to start the investigations, and because when you see under investigation, what that really means is we haven't had the opportunity oftentimes to reach out to that particular case and get more information. And because MedSys does not always paint a real complete picture for us because we're not always doing the data entry. So we need to contact that person to gather more information to enter into that system. And so that if there are gaps and we've been unable to contact that person up to that point, which is that day basically, in order to report out on that day, then the answer will be yes. But what this data entry person will help considerably in bringing some of that administrative and data entry burden off some of the nurses, and will allow them to continue on with those investigations in a more timely manner. But I think they're doing their best to keep up with the cases, but they keep coming in. So.
Okay, my question is then, if let's say we had 6 on over the weekend, and then we had more on the Monday report, more on the Tuesday report, Wednesday, and now we're getting till today, do we now have 24 that are under investigation that we haven't gotten to?
Well, we're working on those investigations every day. So in other words, what was reported as under investigation a couple of days ago has probably already been addressed by one of the nurses, and that investigation is started. But we've already reported it out, so I'm not sure how to get that information circle back to you.
I would think that what we would do is if we have a bunch that are under investigation and we're not counting those, we wouldn't be reporting them.
So what we're doing is, if we're not going to report them the way we've structured it so far, then it would put us out of sync, if you will, with not just the ADHS website, but just looking at how we've structured our reporting system. That would be more difficult for us to do. If you would prefer, for example, that we wait to report a case until we have more complete information, we can do that. It might make, I need to check with the epidemiologists and the nursing staff to see if there are any challenges to that. Because right now we pull an extract out of MedSys every day for that 24-hour report, and that's what we provide. If we delay that by a day, then we may have more information the next day, but then we would have a day without any kind of cases, or it would be a reduced case count based on only those that we were able to reach.
Well, what we're doing is, at least from the impression that we're giving the public, is that we're not following up. Now, we can say that we're behind in contacting people, but if we're just taking the MedSys information and putting that up, but yet we're saying that we don't believe MedSys numbers and we have to go back and adjust later, it seems to me that we put up the ones that we have verified as positive. We might have one day that's bad, but at least we would know where we're at with confirmed positive cases by Mojave County.
Right. Well, and I don't think the nurses are not completing the investigations in a timely manner. I may have misstated that. I didn't mean to say it quite that way. I just believe that they can't always get to every case every day that it comes out, especially when we're getting 10 and 12 cases in a day. There's no way. And some of those cases don't come in until 3 or 4 o'clock in the afternoon. They're not reported. And in those cases, we wouldn't necessarily have the opportunity to reach out to that particular person. So it would mean delaying that report on that case a day until we have more information.
Denise, I believe County Manager Hendricks would like to make a comment at this point.
Thank you, Madam Chairman. Just from an uninformed perspective, could you have another reporting category of cases under investigation, and then list those cases that have been resolved, and because they're not seeing, all they're seeing is under investigation. They're not seeing a final there. But if you could, and that's just a suggestion to the board, there'd be a separate category that wouldn't be confused in new cases. It'd be cases under investigation, and then those cases that the cause was resolved would be listed. Would that be possible?
You know, excuse me, thank you. I think I just need to check with my team first, and it's more just trying to figure out how to do that and make sure that we can get that data to you in an organized and understandable format and follow up. So let me see what I can do on my end. Okay?
Madam Chair?
Yes, go ahead.
Thank you, Madam Chair. I thought about what Manager Hendricks is saying also, but I think it gets more confusing with the public. While the health department can put out some numbers, then it goes to the public information officer who puts it out, and the board members all go off what the public information officer does. But the health department, and I'm saying they don't get any questions, but the board and the PIO are the ones that are getting the heck beat out of them because we don't know what's going on. If we put an addition out saying, well, we had 6 cases in the last week, and we finally traced them down, and some of them are family related, some of them are long-term care facilities. It's just too much information that's not tied with something, where now we say we have somebody in a certain age range and they tested positive and it's family related. Everybody understands that and doesn't get confused, but I think we confuse the people when we try to go back, because now they don't know, well, was that 80-year-old from the 12th or the 13th or the 14th? What about the guy from the 15th? If we can do it all at once, to me it just seems better and cleaner, so that the rest of us don't have to answer all the questions that we don't have the answers for. Thank you, Madam Chair.
And Supervisor Johnson, just the other point I want to make here is that at this point, with our numbers the way they are, the graphs and some of the other visual pieces of information, I think, are as or more important, because we're starting to show those trends. And so rather than looking at things on an individual case level, it's really looking at things in a bigger picture. And that's really the messaging that we're trying to get out is now, for example, by looking at the different age ranges on the chart, it's not about one person being in a 30 to 39 age bracket or one person in a 40 to 49, but it's the fact that we have now 57 in the 19 to 29. So it's all kind of the bigger picture of all of the cases, and how really the even distribution in age of these cases is really showing that everybody is susceptible and everybody should be taking precautions. It doesn't matter what age group you are anymore. It doesn't matter. It never really did. But you can see that that number is really important, and that graph is really important for that reason. It's similar to case by gender, of looking at who's more affected by this, males or females, and do we understand why that would be the case? Are they caretakers to people? Are they playing different roles? Are they in different workplaces? Things of that nature. Looking at the all case count by week of report, it's really that bigger picture to show, are we showing increases every week? Are we showing, do we have any decreases? And kind of putting all that data together to give you a much bigger picture of really what we have in our communities, rather than it being on an individual case level. Because the nurses do investigate every case. Every single one of them gets investigated, whether or not it happens that day or the next day. So we need to be, I'm trying to be mindful of the time that they're spending in doing this type of work and their ability to report out all of the relevant information, and really in the big picture what we're trying to really emphasize.
Well, I understand what you're saying there, but I think it's important that we put out, that we have the age ranges when we do it to begin with, because just like with Bullhead, where they saw that tremendous growth, and then it took us forever to pry out of of anybody that it was from long-term care facilities. The problem we have is we've given the public and the press this information previously. Now, if we decide to stop doing it and just put in, oh, it's a mystery to us where they got this, that's what they're going to think. It's a mystery. The county doesn't know what they're doing. Once you start something, it's really hard to stop it and not get beat up over it.
So the other point to make, sorry, I've just had a staff person who was helping me respond to that question as well. But under investigation is also, let me pull up the text here. Also applies to those cases that are not in our jurisdiction. So it may be that we don't know what jurisdiction they're in at that point, and we need to research that. But at this point, they're in our county. They're in our service area.
I think we all understand that, and I don't believe any of us have any problem with, because we don't want to put something out and then have to retract it the next day. As long as they're investigating it, I don't think we should be reporting it, because it just causes confusion for our public information officer, for the public, and for the board to try to answer the questions of why we can't add 1 and 1 to get 2.
Well, and as I said, I'll go back and listen to my staff and try to figure out how we can do that. But I also want to make sure that we're, again, really seeking your help in helping people understand some of the challenges with data management in these cases, that it's not this simple 1 + 1 = 2, because there could be a day where, like yesterday, where we had 2 cases removed from our, that were transferred out of our caseload. And in those cases, we don't always control the fact that they were moved. Oftentimes, they might be removed and we don't know why. And we can look at the fact that they may have been in a different jurisdiction and that was corrected, because we're not the only ones that enter this information in. And again, that's why sometimes it's not as complete as we want, so we have to fill in gaps in information.
Okay, I think we understand that, but if the state puts them in and they send them to us, and then we verify the information and put it out, it should be pretty good information, unless those people, even if they move to another location, they still were counted under our county, I would assume. If somebody goes to California, say they were here in Lake Havasu, and now they've decided to go over and spend their time in California, it was still our case, correct?
Not if that person's permanent residence was in a different county or a different state.
Right, but we wouldn't have counted them if they were in a different county.
But
or
we've been counting what has been put into our case initially, and it's not until after the investigation or during that investigation that we may learn that that case is not in our jurisdiction, so it gets corrected.
Right, and that brings us back to, let's not report it until we've done our investigation.
Okay. All right, let me see what I can do on my end.
Okay, Denise, I have a question. I'm getting invites, and I'm sure the other supervisors are as well, to large group gatherings now. It seems like everybody is getting more relaxed with the COVID-19. And our current recommendations, have they changed at all? Are we still looking at keeping groups smaller than 10 and the social distancing of 6 foot apart?
Yes, those are all still the recommendations moving forward.
Okay, and when will we see those recommendations change? Is that when our numbers start going down significantly?
Right. I think when you start seeing a downward trajectory of our numbers, you can start looking at how we might approach that. But you might also be able to attribute that success in lower numbers to the fact that people are maintaining that social distance and practicing all of those preventative measures and not having groups of more than 10. So, you know, that's where your success comes from. But I also realize it's very easy to look at that success and go, oh, okay, we're good. We don't have any other issues. We're fine. We can go back to normal. but we're not in that place yet.
Do you think that's something that should be put back out as a news release to remind our citizens that we're not completely out of the woods yet? In fact, our numbers are still gaining.
Yes, I think it would be helpful.
Okay. Thank you. Are there any other questions? All right. Denise, do you have anything further for us?
I do not.
All right. I will then adjourn the meeting. Thank you all for attending.